Lips make you cry when I'm moving around you. Do it once, do it twice. Hop push back, you hold me tight. Get a taste for a night. Baby, show me you can calm down, calm down. Dance with me and take the lead now, lead now. Got you so high that you can't calm down, calm down. Don't you ask, you know you're allowed. When it's you, I can't say no. Baby, give me love. You got me like baby, come give me a
Hello, Sanjay. Prajapati. Hello. Okay, I don't know about that, but confusion की बात नहीं है. Okay, so we are going to discuss some important questions. Hello everybody, from some previous year pharmacology exams. So I have a few questions. और hi, I'm good, Sanjay. Last time क्या था, we had discussed about few important questions from endocrinology, and now this time few more questions from the topic of endocrinology, because some of the students said that if the topic wise, if we discuss the MCQs, it is much better for them to retain. So I guess that's the thing that we can do this time also, and last time also I did. So I'll be better. Most of the questions, if you've revised, you would be knowing the answers. But kai bari we feel that some of the questions you do not know the answer. That's perfectly okay. The sessions are just to help you revise, and in case you feel there is something that you still are not able to retain or not able to recall, so make notes of it. So whenever you sit for any such session, whether it is this session or any session or MCQ or koi bhi videos you are watching, always best use is always when you keep a pencil and a notepad ready, because you will forget the moment you switch off those videos, and whatever new information has come in, everything will go after that video. So if you really want to get the best out of whatever videos or educational videos you're watching, and if you want to make use of that time jo aap de rahe ho usko, so the best use is always to put any information, new information jo aapko lagti hai ki this I do not know, I didn't know it before, add on to your notes, because then at the end towards your exams, your notes are going to be your best friends, right? So your questions, jo previous year questions hai, jo bhi aapne us pe notes banaye hai, especially this is, I'm talking about the examination later on. So in exams, during exams, we don't have much time to go through lots and lots of resources. So whatever time right now you have to gather information from resources, the best way would be always that you have a register or a notebook where you make notes. So in that itself, don't keep 10 registers for pharmacology, for any subject. Keep one major register, and in that you keep on adding the different knowledge or different aspects that you feel that which is new, jo aapne naya seekha hai, you keep on adding to that. So that becomes your Bible later on, right? All right, so let's start with the questions first. And the first question from the previous year MCQ pharmacology was, which insulin is never mixed with other insulins? Which insulin is never mixed with other insulins? First option is glargine. Second option is aspart. Third option is lente. And fourth option is regular insulin. So which of these insulins is never to be mixed with another insulin? So if you know the answer, you can type in the answers. So let's see, even if you do not know, type in any answer. So even if you're wrong, doesn't matter. If you're right, bonus points. But agar kuch nahi bhi aata, it's okay. Just attempt. इनमें से which of the insulin is never mixed with any other insulin? Option number 1 is glargine. Option number 2 is aspart. Option number 3 is lente. And option number 4 is regular insulin. So can you tell me कौन सी इंसुलिन हम किसी के साथ मिक्स नहीं करते? We do not mix with any other insulin. Type in your answers. Let's see. Which of the insulins we do not mix with any other insulin? Of course, I'll tell you, but first let me just guess if you don't know. Lente. Okay. Ansh says Lente. All right. Any other? Any other response? Anybody feels it is the other insulin? Yes. Now this is a very important MCQ because it has a base why this insulin. So it has been asked in various forms about this insulin, that kaunsa insulin is not mixed. So the correct option is insulin glargine. If you don't know this before, just write down. Glargine is never mixed with any insulin. It's glargine. Why? Why? Because it has a very acidic pH. Because of this acidic pH of glargine, it cannot be mixed with any other insulin. So all of you, if you did not know about this, make note that insulin glargine is never mixed with any other insulin. So this kind of MCQ is asked because, and the reason for you to know is because it has an acidic pH. So it is not mixed with any other insulin. Right. Let's go on to the now next MCQ. And this is again from the chapter of, anti-diabetic drugs. Now, DPP inhibitor, which can be used in renal failure, is regular insulin amino. It can be mixed. You get that mixed start jo milti hai market mein, human mixed start 70, 30, 50, 50. It has a regular insulin along with isophane. So it can be mixed with some other insulin. But glargine cannot be mixed. Okay. All right. So DPP4 inhibitor, which can be used in renal failure. So any patient who is a diabetic but now has some kind of problem in the kidneys and he has a renal failure. Which out of these DPP inhibitors can still be used in that patient? Options are: first is sitagliptin, second is linagliptin, third is saxagliptin, and fourth is vildagliptins. So you know that DPP inhibitors are also called as gliptins. So jitne bhi drugs mein gliptins is the suffix, they are all your dipeptidyl peptidase inhibitors, DPP4 inhibitors. So which of these DPP4 inhibitors can be used in renal failures? Options I'll repeat again: sitagliptin, linagliptin, saxagliptin, and vildagliptin. So which of these do you think can be used in renal failure? कर सकते हैं. The others we do not prefer to use in renal failure. We have to either decrease the dose or prefer not to use them at all. So, but there is one gliptin which is safe, which can be used in renal failure. Which out of this is that DPP4 inhibitor? Sitagliptin, linagliptin, saxagliptin, or vildagliptin? So this is another important thing to know about these drugs, which are your DPP4 inhibitors. Asked also in the previous exams. So yes, come on, let me know. Kaunsa insulin? And I will tell you a trick to remember this particular insulin, which is used in renal failure. Yes, let's have the answers. Sitagliptin. Amino says sitagliptin. Okay. Any other? Any other option? Sitagliptin or yes? No? Nahi pata? Okay, chalo, I'll tell you. So the DPP4 inhibitor which can be used in renal failure is your linagliptin. ठीक है? Lina, linagliptin, which can be used in renal failure. Now, how to remember this is because this drug is mainly excreted by the liver as such, not by the kidneys. So, L for lina, L for liver. So, it is safer in kidney disease. Baki sari drugs are mainly excreted by the kidneys. So, this is one of the drug which is not only just less than 5% of the drug is excreted in the kidneys, linagliptins. Therefore, it can be used in kidney failures or renal failures. Baki jitne bhi DPP4 inhibitors hain, they cannot be used in renal failures. Alright. Let's go to the another question. All right. Now, combined pills reduce the risk of which of the following cancers? Combined pills reduce the risk of which of the following cancers? First, ovarian cancer. Second, breast cancer. Third, vaginal cancer. Fourth, cervical cancer. So combined pills can reduce the risk of which of the following cancer? Options are ovarian cancer, breast cancer, vaginal cancer or cervical cancer. Yes. किस कैंसर का रिड्यूस कर सकते हैं रिस्क? कंबाइंड पिल. दे आर नोन टू रिड्यूस द रिस्क ऑफ विच पर्टिकुलर कैंसर? Ovarian cancer, breast cancer, vaginal cancer, cervical cancer. Yes, answer. Let's have the answer. Okay, Vidhayaka said the options, I think I have told you, it's linagliptin and not sitagliptin, right? Okay, so the answer for this, combined pills, which cancers ka risk is reduced by the combined pills? You can guess also, agar nahi aata, just take a guess. Which cancer risk is reduced with combined pills? No? Okay. So, the answer is ovarian cancer. Ovarian cancer. The risk of ovarian cancers is reduced by, very good Sange. I guess, yes, right. No, not vaginal, it is ovarian. Ovarian cancer ka risk is reduced by the use of combined pills, right? Not breast cancer also. It is ovarian cancer. All right. So, they reduce the risk. So, this is one of the advantages. They say like the risk is reduced with this. So, again, important question asked in the previous years. Next question. Which of the following drugs is a stimulator of insulin release? Which of the following drugs is a stimulator of insulin release? Listen to the options. First is metformin. Second is acarbose. Third is meglitinide. Fourth is thiazolidinediones. In चारों में से, out of these four, which of the drug or the group is a stimulator of insulin release? Options are metformin, acarbose, meglitinides or thiazolidinediones. Yes. Now this is an easy question. So you need to know the mechanisms of various oral anti-diabetic drugs. So which of them is stimulating the release of insulin? So causing the release of insulin basically out of this. Metformin, acarbose, meglitinides or thiazolidinediones. Metformin, okay. Sahil says metformin. Any other? Anybody who has a different answer or agrees with Sahil's answer? Metformin? Meglitinides. Arnav says meglitinides. Sange says metformin. Okay. All right. Yes. Okay. So the correct option is here meglitinides. Meglitinides are the insulin releasers. Along with which other group is an insulin releaser? Vidhayak, metformin. Metformins actually are insulin sensitizers. They sensitize the peripheral tissues to the effect of insulin. वो release नहीं कराते. They don't cause the release of insulin. They are more concerned with the increasing the sensitivity of the peripheral tissues to the insulin. So that's why you'll see that patients on insulin, if they are given metformin along with, so it's a very good combination because insulin de rahe hain and the peripheral tissues are also becoming more sensitive to the effect of insulin when you're giving metformin alongside. Okay? So it is meglitinides. So I was asking any other drug groups that you know is also an insulin releaser, or we call it, classify jab karte hain, we call them as insulin secretagogues. Insulin secretagogues. Which other drug group or oral antidiabetic is also an insulin secretagogue apart from meglitinides? Sulfonylureas, very good, excellent. Sulfonylureas are also the insulin secretors because they act on the ATP sensitive potassium channel. So if you go back to the mechanism of action of these drugs, you'll find that they act on the ATP sensitive potassium channels and block them. That's how they cause the release of insulin. Acarbose, what is the role of acarbose? It is an alpha glucosidase inhibitor. And what are thiazolidine diones? They are PPAR agonists. So all of them have different mechanisms. But stimulator of insulin release in में से is your meglitinides, repaglinide, nataglinide, वो सारे groups हैं. Somebody today in our simply pharmacology group posted a very a very nice thing about metformin, something which is, then you can make it easier to remember. In this world of insulin resistance, be someone's metformin. So this way you can remember that metformin is used in people who are insulin resistant. So it's an insulin sensitizer. It's such a interesting line, right? So in this world of insulin resistance, be someone's metformin. So that's like, you can remember this way, right? All right, let's go to the next one. Is conversion of T4 to T3 is inhibited by all except. Conversion of T4 to T3, it's also called as peripheral conversion of T4 to T3 is inhibited by all except propranolol, propylthiouracil, amiodarone and methimazole. Okay, so which of these does not inhibit the peripheral conversion of T4 to T3, right? So the options are propranolol, propylthiouracil, amiodarone and methimazole. So can you tell me the correct option to this? Conversion of T4 to T3 is inhibited by all except. Which is the drug which does not cause conversion of T4 to T3? Methimazole. All right, Arnav says methimazole. Any other? Any other? Methimazole, right? Or any other? So all the conversion of T4 to T3 is inhibited by all except propranolol, propylthiouracil, amiodarone or methimazole. Which of them is a correct option? So it's right, Ardav is right in saying that it is methimazole. So methimazole does not cause the peripheral conversion of T4 to T3. Propranolol causes, propylthiouracil causes, amiodarone causes. So remember that propylthiouracil, very good Vidhayak, it is methimazole, rest, absolutely correct. Propylthiouracil, methimazole, carbimazole, they belong to the same class of drugs. They are all thyroid peroxidase inhibitors, But the only difference in the action of propylthiouracil with methimazole or carbimazole is this only. Propylthiouracil is also inhibiting the peripheral conversion. So propylthiouracil starts with the P, peripheral conversion starts with the P. So propylthiouracil also inhibits the peripheral conversion of T4 to T3. So methimazole does not do that. So this is the important difference between these two drugs, though they are classified in the same class in the antithyroid drugs, right? All right. Now next one. Teriparatide. Teriparatide acts by option number 1, increasing the osteoblastic activity. Option 2, decreasing the osteoclastic activity. Option number 3, decreasing the osteoclastic and increasing the osteoblastic activity. And number 4, increasing calcium. So which of these are the actions of teriparatide? Again, I will repeat the options. First is increasing the osteoblastic activity. Second option is decreasing the osteoclastic activity. Third option is decreasing the osteoclastic activity as well as increasing the osteoblastic activity. And fourth is increasing the calcium. So teriparatide acts by which of the following mechanisms? Which is the mechanism for teriparatide? So I hope you know that teriparatide is a recombinant parathyroid hormone. Okay, it's a recombinant parathyroid hormone. So now what is its mechanism of action? Whether it increases only the osteoblastic activity, or it decreases the osteoclastic activity, or it does both, or it increases the calcium. So what is the correct option in this MCQ? Increases the osteoblastic activity. All right. Arnav says it increases the osteoblastic activity. Okay. Yes. Okay. And decreases the resorption. Okay. So that means that is third. Okay. You're saying the third option. All right. So teriparatide is one of the drugs used for osteoporosis. And what is the mechanism? So the mechanism of teriparatide actually is one. It only increases the osteoblastic activity because it is a recombinant parathyroid hormone. So it just a part of parathyroid is used, and it has become now teriparatide. So it doesn't have any effect on the osteoclastic. So Pooja, no, it doesn't cause decrease in the blood calcium. So if something decreases the blood calcium, how can they act? So the option was increasing the calcium, whether it increases the calcium. So the answer of teriparatide ka main mechanism of action is it increases the osteoblastic activity. There is no effect on the osteoclastic activity. So remember, these parathyroids usually इनका हम कहते हैं low dose and intermittent dose. They increase the osteoblastic action. ठीक है? When you give a high dose and repeated give dose, then it causes the opposite effect, osteoclastic. So for teriparatide, remember, it increases the osteoblastic action, right? All right. So the next one is drug of choice for esophageal varices is. Drug of choice for esophageal varices is. Option number 1 is demeclocycline. Option number 2 is dopamine. Option number 3 is adrenaline. Option number 4 is octreotide. ठीक है? Which is the drug of choice for esophageal varices? Demeclocycline, dopamine, adrenaline, or octreotide? Yes, this has been asked quite a lot. I think I've discussed this before also. So it's a very common question which has been seen. I think 2-3 times this was repeated in various previous exams. Drug of choice for esophageal. Very good, Arnav. Octreotide. Yes. The correct option is octreotide. So this is the drug of choice for esophageal varices. It's a somatostatin analog, so it is used for esophageal varices. Please remember this. This is quite often asked what is the role of octreotide, and it is a drug of choice for esophageal varices because it constricts the vessels, the splanchnic hepatic vessels as well as the renal blood vessels. So it causes constriction. So that's why it is the drug of choice for this particular disease. Now, next one is dose of ulipristal. Dose of ulipristal is 30 milligrams, 30 micrograms, 30 grams, or 60 milligrams. So before I go to the dose, first can anybody tell me what is ulipristal? ulipristal. होता क्या है? What is ulipristal? And then we go on to the dose. What is ulipristal? Because today's questions are from endocrinology, so this drug is somewhere in endocrinology. That's the hint. So where is ulipristal used? 30 milligrams. But what is ulipristal? You're right, Arnav, it is 30 milligrams. But what is ulipristal? It's an emergency contraceptive. Excellent. It is an emergency contraceptive. And to which group or class of drug does this belong to? Which class of drug does this? Because this is another MCQ. In another MCQ, it was asked that ulipristal belongs to which dash class of drug. So which class of drug does this belong to? Ulipristal. Ulipristal. Which class of drugs? It's absolutely correct. 30 milligrams within 5 days it is used as an emergency contraceptive. So my question is that, do you know to which class of drug does this ulipristal belong to? कौन सी class को belong करता है? Any idea? Very good. So it belongs to selective progesterone receptor modulator. So Ansh, when I say class of drug, yes, it means kaun sa class of, how do you classify this? That's what the question is. So when we are classifying this, hormones can be any hormone, right? So when you classify drugs in pharmacology, you should know that to which heading dena hai, to which class of drug does this belong to. So this belongs to a group of drug, a class of drug which is called as SPRM. Selective Progesterone Receptor Modulator. जैसे हमारे पास SERMs होते हैं, SERM, Selective Estrogen Receptor Modulators, ठीक है? So you have tamoxifen, raloxifene और ormeloxifene, वो SERMs हैं. So इसी तरह से we have SPRM, Selective Progesterone Receptor Modulator, and इसमें recently approved is ulipristal. So it is approved as an emergency contraceptive, which can be used even up to 5 days. All the other emergency contraceptives, if you remember, they can be used only up to 72 hours or 3 days. But this is one which can be used up to 5 days. So this is an important drug to know. Its dose is also important to know. 30 milligrams, and you can give it, it should be given within 5 days. Now, the next one is oxytocin is useful in PPH. Due to the stimulation of oxytocin is useful in PPH, postpartum hemorrhage, due to the stimulation of number 1, prostaglandin F2 alpha, prostaglandin E2, prostacyclin या thromboxane. Which receptor? Stimulation of what? Oxytocin is helpful, or it is used in PPH because of the stimulation of prostaglandin F2 alpha, prostaglandin E2, prostacyclin और thromboxane. इनमें से कौन सा ऑप्शन करेक्ट है फॉर ऑक्सीटोसिन? Which of the options is correct? Prostaglandin P2 alpha, F2 alpha, prostaglandin E2, prostacyclin या thromboxane? On what receptors on type, or on what does oxytocin act here? As it is, if it is used in PPH. Which of the following? Yes? No? Very good, Abhinav. PGF2 alpha. Yes. So the correct option is oxytocin acts on, not sure. No, it is correct, Arnav. Absolutely correct. It's PGF2 alpha only. So oxytocin acts on PGF2 alpha, and therefore it is used in the PPH. Right? Alright. So the last question of the day is, ergotamine is used in the following conditions except ergometrin, not ergotamine. Ergometrin is used in the following conditions except. So where is it not used? First option is to control or to prevent the PPH. Second option is insufficient uterine involution. Number 3, uterine inertia during labor. And number 4, to prevent uterine atony after cesarean section. So please listen to the options again. Ergometrin is used in all the conditions which I am telling you, except, so there is one condition where ergometrin is not used. So first condition is control of or prevention of PPH. Second condition is when there is insufficient uterine involution. Third condition is uterine inertia during labor. And number 4 is prevention of uterine atony after cesarean section. So in which of the conditions is ergometrin not used? Okay? So in which of these conditions is ergometrin not used? So if you will go and look in the books and see the uses of ergometrin, you will find all of these uses except one. So that is all of these are uses of ergometrin except one. No, it is very effective in prevention of PPH. Okay? It is used in PPH. Prevention or control. Ergometrin is used. Or so just to make you understand, uterine involution hota hai ki when uterus, it goes back to its original size. Okay? So when it goes back to its original size after delivery, so the uterus has to involute. Involute means it has to go back to its original size. So if it fails to go back to its original size, so can ergometrin be used there? The third is uterine inertia during labor. The uterus is not contracting much. जब labor चल रहा है patient का, so the uterus is not contracting enough. The fourth था prevent the uterine atony after cesarean section. So after the cesarean section. So again, if you want, atony means that the muscles are lax and they are not going back into the original shape and original size. So in sare condition, all these conditions, you usually use ergometrins for that condition. हाँ, PPH में use कर रहे हैं. I'm saying which of the condition it is not used. We can use this. Control or prevent, yes. Yes, you can use. But I'm asking where it is not used at all. See, if you see the option number 3, which I said, uterine inertia during labor. Okay? So, if you want to enhance the uterine contractions during labor, the drug which is preferred is oxytocin and not ergometrin. So, this is one condition where we do not use preferably the ergometrin. Ergometrin is not used. Oxytocin is the drug of choice, so it is preferred. During labor, it is oxytocin. Okay, so this option number C is the option where ergometrin is not used. So if you see all these reasons, and out of these uses also, ergometrin ka mainly use is in the first one, which is control or prevention of PPH. If they feel that this can be one of the reasons, because agar uterine atony, in the sense muscles, they don't contract, and even that can end up in bleeding. Bleeding control नहीं होएगी, and that can also land a patient into PPH. So वहाँ पे we can use this. ठीक है? अच्छा, contraindicated. Okay, that is okay. Yeah. So remember, these are the most important use. अगर इसमें से पूछे, most important is still your prevention of PPH. The other uses also like insufficient uterine involution, not preferred. We don't use that too much. It is just in theory. Books में ज़्यादा है. हम बहुत इसको usually तब देते हैं. If it's a multiparous lady, and वहाँ पे prophylactically देंगे because we know that the uterus is not going to involute. But otherwise अगर practical common use देखें तो it is still control or prevention of PPH. But during labor जहाँ पे भी आता है, during labor हमेशा if you want to enhance the contractions नहीं हो रहे हैं तो वहाँ पे you will see that we always prefer oxytocin and not ergometrin. So this condition is where ergometrin is not used. So these were another set of 10 questions. 10 questions we discussed in the last live session, and these are another set of 10 questions which are have been asked in the previous exams. And what is important about all these questions is, so you should know that whatever questions are asked, when you go through these questions, एक तो आप if you are only preparing for MCQs, that is okay. But let's say you are still in second year, or you still have to go through the pharmacology university exam. So you see the pattern of questions asked. So usually both high yield questions होते हैं. So try to also frame your answers around this. Let's say ergometrin पूछा है, so try and go back and see what are the uses of ergometrin, whether you can write a short note on ergometrin. Oxytocin, go back and see what are the uses of oxytocin. Similarly, when we discuss the drugs, insulin wali drugs ki anti-diabetic drugs ki DPP4 inhibitors, so go back and you see that these are the questions which are so many times asked, and many questions are even now asked in your university examinations. So go back and refer to these chapters because they are more high yielding, so lay more focus on these when you are studying. इसको आप स्टार लगा सकते हो कि I have to know these questions, must know questions, and these questions should be on your fingertips. And they're very practical questions also. When you see in the clinical practice, diabetes is so common, you will see these drugs being given. You will see that a patient of diabetes, when they develop the kidney disease, because they eventually progress होती है diabetes, they involve the kidneys, where they are already being, let's say they were prescribed DPP4 inhibitors, and ये drug एकदम से बंद कर दी जाती है. And you will see practical. So that is what it is not only कि आप रट्टा मार रहे हो इसको, that is a thing, but understand that these questions are also clinically also related. Ergometrin PPH में आप देखोगे, gynae postings में जाओगे या कहीं पे भी, they are using it. ठीक है, all your जो drugs हम कर रहे हैं, propyl thyroxine वगैरह, they are being used. So this is how you clinically correlate, and these are important questions. So make note of when you, I said initially, always when you attend such sessions, as I said, मैं शुरू मैंने बात की थी, keep a paper and a pen ready with you. Never attend sessions just like attend किया चले गए भूल गए. You will forget everything in less than 1 hour. Retention नहीं है होएगी आपकी. So until unless you've written down the important questions, so the next time or next day when you go back and you're studying your pharmacology, you'll go back to these questions. Okay, this was the important question. ये मुझे नहीं आता, ये मुझे आता है. So I have to lay more focus on this. So that's the whole crux of when we are doing such sessions. The benefit you will get, the more you write, the more you revise, and then more you recall the other day. This is how your pharmacology basics and questions are going to retain, or you're going to retain these knowledge for a longer period of time and not forget it the very next second. पहले से बताया था, I think in the Insta live पे जब when I post, I already write endocrinology, मैंने लिखा हुआ था आज. ठीक है, so आज जब सुबह when Insta live का topic है, I always write the actually topic. Yes, definitely. अब at least for today you know that कि हमने ये कर लिया है, endocrinology हो गई है. So पिछला session you can watch, जो important questions discuss हो गए, whatever they were discussed, at least go back. You can write those points कि ये point, you don't have to write the whole MCQ, but at least write the correct answer. जैसे इसका choice, drug of choice ये है, इसकी dose ये है. Now you know this, so you can write down those points. ठीक है, so that you can at least 20 important questions you can important points now you can know from these 2 sessions only. 20 important questions in endocrinology काफी होते हैं, ठीक है, for per chapter if you do. So every section if we do like sessions, and I will give 10 questions, so 20 questions per session is a good amount of revision, right? All right then, if there is anything or apart from MCQs, if you want, like there can be short topics which can be discussed, or because you can DM me and then I can prepare and we can have a discussion. But short topics. We won't be able to do long sessions, but anything which can be done in 15 minutes. Even if it's not like, sometimes there are issues like how to write exams, how to appear in Viva, how to fight stress, or how, even those kinds of topics you can, tell me, and I can prepare a live session. We can discuss more often on that aspect, because that's equally important. Your mental, apart from studies, the how you deal with your subjects and aspects on a day-to-day basis, the mental strength, everything is important. Motivation chahiye, that is also okay. ठीक है? Yeah, we can discuss short topics, sure. But then I would ask that everybody should study and then discuss. I will overview denge, then it makes more sense if you also come prepared, and we can have sessions on that. No problem. I'll take note of that, Ansh. Done. All right. Small we can discuss. Even actually MCQs when we take MCQs, we can, that's why I do, I discuss if there are the other options also. Unke bhi mechanisms I discuss, so that you know why this is not the correct answer. This is the correct answer. So even in MCQs, we can do all that. That's the basic aim, right? So next time we can do lesser number of MCQs, but only MCQs ko we can discuss in detail. So you know that jo option theek hai, wo kyun theek hai, jo theek nahi hai, wo kyun theek nahi hai. So you know both the aspects. All right. So on that note, have a great weekend. See you in the next live session. Take care. All the best.